How does myofascial releases target fascia for CFS and ME relief? Imagine your body's connective tissue, called fascia, as a web that surrounds muscles, bones, nerves, and organs, helping everything move smoothly. When this web becomes tight or sticky due to injury, stress, or inflammation, it can cause discomfort and stiffness. In some cases, this may even contribute to feelings of fatigue or pain common in chronic fatigue syndrome and myalgic encephalomyelitis. Myofascial releases is a gentle hands-on therapy designed to address these restrictions. Unlike deep pressure massage, it uses slow, steady light pressure to stretch and loosen the fascia. The therapist applies this pressure until they feel the tissue begin to releases, often described as a sensation of melting or unwinding. This process aims to restore normal movement and reduce tension in the connective tissue, which can help ease muscle pain and stiffness. For people with chronic fatigue syndrome or myalgic encephalomyelitis, the idea is that relaxing the fascia might help lessen some physical discomforts that can worsen fatigue. Since many individuals with these conditions experience heightened sensitivity to touch and muscle tightness, myofascial releases offers a gentle approach that can be tailored to individual tolerance levels. It may improve circulation, reduce muscle tension, and promote a calming effect on the nervous system, which could potentially lead to feeling a bit more comfortable and less fatigued. While there is limited specific research on myofascial releases for CFS or ME, some studies in related conditions like fibromyalgia show that this therapy can reduce pain and improve quality of life. These benefits are thought to come from decreased muscle tension, better blood flow, and a calming influence on the nervous system. Many people report feeling less pain and more energy after gentle manual therapies, but it's important to remember that responses vary from person to person. Since CFS and ME are complex illnesses affecting multiple body systems, fascial restrictions are just one piece of the puzzle. The exact causes of these conditions are not fully understood, and there is no cure through any single therapy. Myofascial releases should be viewed as a complementary approach that might help manage symptoms like muscle pain and stiffness, rather than a cure. For those considering this therapy, caution is key. Because many with CFS or ME are sensitive to touch and prone to post-exertional malaise, therapists should perform techniques very gently. Overly vigorous pressure can cause more fatigue or discomfort. Some individuals also find self-myofascial releases, like using foam rollers or gentle stretching, helpful, but these should be done carefully and ideally under professional guidance to avoid overexertion. In summary, myofascial releases works by applying gentle, sustained pressure to loosen restrictions in the fascia, which can improve tissue mobility. For people with CFS or ME, this might help reduce muscle pain and stiffness, potentially making daily activities more comfortable. However, it is just one part of a broader management plan and should always be discussed with healthcare providers to ensure it's safe and suitable for your specific needs. Always seek personalized medical advice before starting any new therapy to support your health journey safely.